Welcome to our week 9 review of exercise 2. We are covering in week 9 chapters 18, kind of finishing that up, and chapters 19. Now, in this section, we're going to be working through key questions. These chapters focus on our role during the planning and opening of a case, the intraoperative period, and immediate postoperative care. Remember, this is not about memorizing answers. Instead, we are going to use different prompts. We're going to help you think critically, apply your textbook, and prepare for exams and your clinical practice. So keep your book nearby, take notes, and let's get started. Question 1. List the primary features in wound healing. Now, what happens immediately when tissue is injured? How does the wound environment change in the days after an injury? Which cells and proteins contribute to new tissue growth? And over the longer term, how does tissue regain strength and structure? In chapter 18, look in the section on phases of wound healing where the sequence of inflammation, proliferation, and remodeling is described. Also, as an ST, how about your intraoperative actions like tissue handling or maintaining sterility affect a patient's wound healing process? Question 2. Halstead's principles of surgery. I want you to list Halstead's principles of surgery and define them. Think about how should tissue be handled to avoid trauma. Why is hemostasis so important to patient safety? How does preserving blood supply contribute to recovery? What is the role of aseptic technique during every single procedure? And what risks arise if tissue tension or dead space is not managed? In chapter 18, I want you to look at the discussion of surgical technique and tissue management, where Halstead's principles are outlined as the foundation of safe practice. Also, imagine you're scrubbed in. How could poor retraction technique or improper suture placement violate one of Halstead's principles and put the patient at risk? Question 3. What are 4 primary techniques of hemostasis used in surgery? What role do clamps and ligature play in bleeding control? How does suturing assist in both hemostasis and wound closure? In what situations would electrosurgery actually be preferred? And how do topical or absorbable hemostatic agents help during surgery? So review chapter 19 in the section of methods of hemostasis. That's going to help you connect specific instruments, sutures, and technologies with surgical bleeding control. Also think of this. In your OR setup, how would you anticipate the surgeon's hemostasis needs differently for a vascular surgery versus a laparoscopic appendectomy? Question 4. What are the guidelines for placement of a surgical tourniquet? What are the tourniquet times for an upper and lower extremity? So think of this. How is tourniquet time measured and documented? What is the maximum safe inflation time for upper and lower extremities? Why does the inflation pressure depend on the patient's blood pressure? What complications can occur if prep solutions seep under the cuff? And what should be done if the procedure extends beyond the safe time limits? Turn to Chapter 19 under Tourniquet Use and Safety for detailed policy guidelines and safe inflation parameters. And if you are the tech setting up for, let's say, a hand procedure, how would you verify that the tourniquet equipment is ready and that time is accurately tracked throughout the case? And our last question: what physical injury can be done to the surgical patient if a surgical tourniquet is not used properly? How does ischemia affect muscle and skin under prolonged pressure? What kind of nerve damage can occur? How might vascular structures be compromised? Why does proper training and adherence to policies even matter for tourniquet use? Again, in Chapter 19, look at the subsection on tourniquet risks and complications. It gives examples of potential nerve and tissue injuries. Also, think about being scrubbed into a long orthopedic case. What signs should you watch for that suggest the tourniquet may be causing harm to the patient? Thank you for working through these review questions with me. Now, by practicing critical thinking and connecting your knowledge to real surgical scenarios, you're building that skill that makes a safe and effective ST. You guys, always use your textbook. Fuller Surgical Technology is what we're using as your primary reference. And remember, what you do in the operating room directly affects patient outcomes. Stay engaged, study consistently, and keep practicing how to think, not just what to memorize. See you in the next review session.